all these nutritionists and stuff, everybody's like, yeah, just have a pile of nuts, and you're like, there's
what
like
kind?
30 grams of fat in there.
So Raj, one of the questions that always comes up, especially from trainees and junior faculty, is how to get involved with societies. I mean, I think they're trying to figure out, should they get involved? Is it worth it?
Right.
And how do they get involved? So how did you get involved?
I mean, that's a great question, and I kind of took a obtuse path. Now that we're here and we're involved in so many different things. As a fellow and a trainee, I always looked up to all these people, and you wonder, wow, will I ever get there? Will I ever be like that? And you kind of cower in their greatness, and you think you'll never be able to do it. But you start putting out abstracts, you start putting out small research articles, you start kind of volunteering information and kind of showing what you can do, and being present, being active, cross-pollinating, and kind of get out and network with people.
Yeah.
Really makes all the difference in the world. And as someone that never thought they would end up involved in any of this, it's been a phenomenal opportunity, and I think it creates a lot of cross-pollination and a lot of development, not only personally but professionally and clinically as well. What about you? How do you?
Yeah, I think it's it's an interesting question. We come out of training, and especially with your first job, or even if you're an interventional fellow, you're so focused on clinical work.
Right.
But one of the great things about interventional is that our clinical work is always on the cutting edge. And so every case we learn something from.
Of course.
Right? So no matter how minor the teaching point is, or if there's a complication, then it's a lot of teaching points. So every single day is a day of learning in the cath lab, right? No matter what. And so I think, I started off just by operating as much as possible, trying to be the highest volume operator, but also taking on complex cases with appropriate mentorship.
Right.
And writing down literally what did I learn from that case. And the practice of putting together a PowerPoint presentation on a case, really forces you to relook at the angiograms, think about it, what are the main takeaway points. And I think that's the lowest point of entry. You can start by just taking your day-to-day practice and submitting those cases. And that really helps because we learn so much from each other all the time. I learn an immense amount from you. And when you get up there and talk about, large bore access, transaxillary approaches, for you that may just be another day in the office. But for hundreds of thousands of other people, that's a really new thing. And so I think that's probably the basis for entry. And then from there, when you get into that's a great entree into the meetings.
Of
and
course.
Then you start to attend the different sessions. It's very important to ask questions. It takes a little bit of courage to get up there and ask a question. But no question I've never seen anybody at a meeting get poo-pooed for asking a simplistic or potentially naive question. I think all questions are valid. It's what the meeting is designed for. And then as you start to engage and you get enough volume and experience, you can start to turn that day-to-day practice into a question answering machine.
Right.
And you can start to collect data as you've done. You can start to write review articles. Just by networking with folks at the meeting, people they're always looking for people to help write projects, get on guideline writing committees. And then, as you know, the SCAI and CRF and TCT have mechanisms to join and actually shoot in an email saying, hey, listen, I'd love to participate on this panel or on this session.
Right.
And they're always looking for people. Yeah. So I think it's critically important because as interventionalists, it's lifelong learning. And if we weren't doing this, we would become obsolete in about 2 or 3 years. And you'd be doing a disservice to your patients, a disservice to your practice, and a disservice to the field. Yeah. So I think it's almost mandatory that we should all get involved. And a great way to start is with case-based learning.
Yeah. And I think it's probably one of the best fields in the sense where everything is progressing and changing. And as we learn from one another, it helps us move the envelope and move the needle forward. We all learn so much, even from the fellows, even from the attendings. And you look at these people and you all get so intimidated, I think, at points. But when you get to know them and feel comfortable, you'll understand and see how humble and really how dedicated everybody here is to education and kind of being inclusive rather than exclusive.
Yeah, it's great.